does a one-size-fits-all approach in conventional lab testing limit patient care, in your opinion?
Well, I think it can be really frustrating, especially if you're someone who has all those symptoms and you go get some testing done and told everything is normal. So one, if all you're getting tested is TSH and it again falls within range, so it's 3.5, 3.8, really, that may not be 100% optimal, but you're being told everything it looks normal, right? So we're putting you in a box and then disregarding that your symptoms may be something that is even an early thyroid dysfunction. I think there's so many directions we can go with this, but traditional or conventional medicine is also driven by what your insurance will pay for, correct? So like sometimes you can't get T3 or T4 or thyroid antibodies or something like that covered by insurance if your thyroid is normal. And so, if TSH, like a lot of times you'll see on an order requisition that you do TSH and it only reflexively tests T3 and T4 if the TSH is abnormal. So sometimes the lab just doesn't do it at all, or the insurance won't cover additional testing if everything appears to be normal. So that's one area. In addition, I think we talk about this all the time, like things may not be completely broken, but yet you may have some dysfunction in your ability to eliminate things. So if you've been exposed to a lot of toxins, your liver has been sort of tanked and stretched, but you're not going to see like broken liver. So you're not going to see like liver changes on lab tests and things like that. So you get sort of this traditional kidney function, liver function, and like a CBC that doesn't show any anemia, or maybe it's like very mild anemia, but that's normal. And so the traditional lab testing that people are seeing like on their every year, I get lab tests done. Those aren't really going to show us anything unless you really have significant liver disease or kidney disease or severe anemia or leukemia or something like that. Those labs are almost always going to be normal. So they're not giving us any insight into some symptoms of why do I feel tired? What else are we looking at? So I think that can be really frustrating if we're put into that box. So finding a provider like myself, somebody that's in integrative functional medicine, hormone balancing type stuff, that's going to dig a little bit deeper and order something like a saliva test that's going to look at all of your hormones as well as adrenal function through cortisol testing, digging a little bit deeper into thyroid antibodies, looking at nutritional deficiencies like vitamin D, B12, some inflammatory markers like CRP, digging a little bit deeper into metabolic stuff like testing insulin levels and markers for insulin resistance that may be abnormal, even though your blood sugar appears within range. So that's another area. Glucose could be anywhere from 70 to 100. If it's floating 98 all the time, that's probably, a sign that there's some pre-diabetes or metabolic dysfunction. And if you don't dig a little bit deeper, then we're going to miss that.